Namaste, welcome to our YouTube channel Analytica Ayurveda, and for the next 30 minutes I am going to engage you with a very interesting topic assigned to me in the conference held at Banaras Hindu University on 4th November by the All India Specialist PG Association and one department of the Banaras Hindu University, that is the Department of Draviguru. And good teachers are here, member, and then this conference was on the mainstreaming of Ayurveda in the primary health care. And they said me to speak on the title in a plenary session as a speaker, and then in that plenary session I just tried to make the things in the way how it is relevant and how it is working. So title for me is their contemporary contribution of Ayurveda in mainstream healthcare system of Bharat, a reality revelation and the way forward to achieve targets of the 2047. Friends, यहाँ ये बात है कि विजन 2047 की बात चल रही है, अमृतकाल 2047 और आत्मनिर्भर भारत, और इसमें फिर ये देखने की बात हो रही है कि हर विभाग, हर व्यवस्था, हर तकनीक, हर इंफ्रास्ट्रक्चर ऑफ द कंट्री भारत मस्ट बी at the level of the developed country up to the 2047. In the same way, here we are having the concept, a target that how Ayurveda is important into the mainstream of the healthcare, that is and what will be the status at the moment in 2023 and what may be in the 2047 and what are the ways for all that. Fine. So before we start, on my screen there are the two screenshots. One is the paper, that is the India and its pluralistic health system, a new philosophy for the universal health coverage. I do believe that everyone is knowing about the universal health coverage, UHC. It is under the SDG, and in the broader aspect the MDG and all the projects and the concepts of the UNO and the UNESCO or the UNDP or the WHO, all intermingled with each other, and that is the service of the humanity, the global service of the humanity, specifically in the purpose of the health care. So here this paper is talking about that the universal health care coverage, universal health coverage, USC, may be served in the better way with the India's its pluralistic health system, and that may be a new philosophy. See how, just I am trying to clear it. USC is concentrated or the based on the conventional system of the medicine, that is the allopathic system of the medicine. But here it is a new philosophy because India has a pluralism of the medical systems. It has 6 more recognized medical systems. They are namely Ayurveda, Unani, Siddha, Sovarikpa, Homeopathy, plus Yoga and the Naturopathy. In this way, its pluralism approach, its pluralistic approach may be very much beneficial, may be helpful to get all the objectives of the UHC. This is the one point. Another is the just 3 days back, it is the antibiotics for the common childhood infections, no longer effective Lancet study. Not 3 days back, it is the news 6 days back. It was hitting all the headlines all across globe on the 1st November. A study published into the Lancet and a study done at the Western Sydney University, Melbourne. Western Sydney University of the Australia, and they are saying that in the childhood antibiotics are not working, and it's a not new problem. Antibiotic resistance AMR is the focus of the many scientists, and it is the very big problem before the humanity. So here also people are talking about the alternatives of the antibiotics, because all the synthetic molecules, chemicals are now having its resistance and not serving the purpose. So the whole scientific community of the world is talking about the something new kind of the antibiotics, maybe that is the herbal antibiotics or the Ayurvedic antibiotics. We have started working on the Ayurveda antibiotics, and that is the mixture of the herbal and the herbo mineral, and this was submitted last year. And I'm happy to inform you all that the scholar Dr. Priya Mohan has been awarded the best thesis award in an international seminar Swasth in the Nepal. She is going to receive this award on the 10th November. So that is the relevancy of the titles what we are discussing, and that is the new concept, that is the Ayurveda antibiotics. So with these two, just I am inviting your attention, what is the position of the Ayurveda at the as of the date of the 7th November 2023 in the country Bharat, in the mainstream health center, main health stream. So here you just see MSc. What one can understand by the word MSc? Mainstream of health care. Generally जब आप बीमार होते हो, कोई भी, right from class to mass, and the majority 98-99% people think about which system of medicine when they are having any kind of sickness, illness or uneasiness, what from minor to major. Undoubtedly that is the allopathy now today, and it is since last 100-150 years. Yes, of course, just I am trying to explain it. See here, health means Ministry of Health and Family Welfare. Very less budget, very meager budget, very less contribution. All the policymakers think about the Ministry of Ayush. Then Central Government of Health Services, the whole scheme, and that is 97-8% infrastructure and the personal as from the allopathy. So it is obviously the main health stream is the allopathy. Then the state governments, same story, medical colleges, same story, the number of medical colleges and the infrastructures there, medical services and the healthcare programs running all across country, either by the central governments or by the state governments, everyone having the prominency of the allopathic system of medicine. Do you think this was the case back 300 years or the back 1000 years or the back 2000 years? Or even back 20 years. So there are scenario change in the whole history. Back 20 years, what was the condition of the allopathy? What was the condition of the Ayurveda? It is entirely changed from 2003 to the 2023. It was different in the 1953. It was different into the 1903. It was different in the 1853, or it was much different into the 1803. So I wish to say that before 300 years, the Ayurveda was the mainstream healthcare system of the country Bharat. Even in this period of all the Nawab or the kings or the emperors of the Islam Dharma, they have not damaged Ayurveda much, but they have not promoted Ayurveda very much. Whereas these British colonial people damaged Ayurveda like anything, not only the Ayurveda, but every Indian knowledge they crushed, they damaged, and the whole Indian psyche of the superiority they damaged. विश्वगुरु की भावना को उन्होंने समाप्त करने का एकदम एक बीड़ा उठा रखा था. Macaulay education policy and the many more much things are there. So if you see, so my point, what I am submitting before you is this, that back 300 years, in a larger canvas, Ayurveda was the mainstream healthcare of the Bharat. But now, 2023, Ayurveda is not mainstream healthcare of the Bharat. Why so? See, the question is, are we existing there in the MSc? Answer, I just told you and you just get, yes, we are. And we are not there in the terms of the service infrastructure and the manpower. आज का जो MSc का definition है, today's MSc, what I talked, Ministry of Health, all the CGHS services, all the other medical colleges, national health programs, and the reports of the World Bank regarding the healthcare system of the country, Bharat, or the health report of the Niti Aayog. I'm sorry to underline it here that the word Ayurveda is not reflecting there. I have gone through the whole scenario, the health reports, Ayurveda word is not there. Neither any notion or the quotation of the Ministry of Ayush in the health reports back 2019 or the 2018. Then I wrote to the Ministry of Ayush, if our contribution is not recorded in the reports of the World Bank or the Niti Aayog in the maintenance of the healthcare system of the Bharat, then for what purpose we are here and what we are doing? Then it was said and it was replied to me that, see, we are publishing a separate report what Ministry of Ayush is doing for the healthcare system of the country. So what I feel that there must be one health report of the country and in which the contributions of the Ministry of Health as well as the Ministry of Ayush must be published together, side by side. Because it is giving a wrong motion, wrong reflection that the whole healthcare system is being governed by the Ministry of Health. So, again my million-dollar question, are we existing there in MC? No, we are there for the even. The question is this, and this is just the narrative form. No, we are not in the MSc, but we are everywhere. Every unit of the family, village, town, district, state, and the nation. The theme of the Ayurveda Day, Ayurveda Divas, is always what? Har ghar har Ayurveda. Har din har ghar Ayurveda. Har ghar har din Ayurveda. Ayurveda for everyone, every day, everywhere. तो इस तरीके से आयुर्वेद तो पूरा है, तो आप कहिए कि हमको मेन हेल्थ स्ट्रीम में तो हम ही हैं. तो वही बात आती है कि गाली दिल बनाने के लिए ख्याल बहुत अच्छा है. आपका कहीं रिकॉर्डिंग नहीं, आपकी कहीं रिपोर्टिंग नहीं, और आप संतुष्ट होते नहीं कि हम तो हर जगह हैं, मेन स्ट्रीम में. और फिर आप सेमिनार भी कर रहे हैं कि हमको मेन स्ट्रीम में हम हैं कि नहीं हैं. और फिर नीति आयोग, प्लानिंग कमीशन आपके लिए प्रपोजल्स ला रहा है कि ब्रिंग आयुष सिस्टम्स इन द मेन स्ट्रीम हेल्थ केयर. दिस टाइटल इटसेल्फ इंडिकेट्स that at the government level and the policy level, even in the society and the elite or the class or the mass, anyone, they are considering that the mainstream healthcare is the allopathy, and now the proposals are going for the inclusion of the Ayush systems into the main healthcare system. सोचिए, 300 साल पहले आप मेन हेल्थ केयर सिस्टम थे और हजारों साल से थे, 5,000, 10,000, जो भी साल जोड़ लीजिए. और किन परिस्थितियों में आप 300 साल में आपकी ये स्थिति हो गई कि आपको सरकारी सहायता की आवश्यकता पड़ रही है कि आपको माना जाए कि आपको कैसे मेन स्ट्रीम में लाया जाए. सो चलिए, वी आर ऑलमोस्ट एवरीवेयर, बिल्कुल सही बात है, बट अनरिकॉग्नाइज इन स्पाइट ऑफ द इनक्रेडिबल सर्विसेज एंड द कंट्रीब्यूशन. इतना सारा करने के बाद भी आपकी सर्विसेज रिकॉग्नाइज नहीं है. तो क्यों नहीं है? तो बट कॉमनर्स एंड द एलाइट डोंट कंसिडर आयुर्वेदा डॉक्ट्रिन्स एज ए हेल्थ केयर सिस्टम. सबसे बड़ी समस्या यही है. घर का जोगी जोगड़ा आन गांव का ज्ञानी है, आन गांव का वैद्य, इस तरह से वो कहावत है. आन गांव का सिद्ध, घर का जोगी जोगड़ा आन गांव का सिद्ध. तो जो घर में है वो उसकी कोई वैल्यू नहीं है। जोगी दूसरे गांव में वो सिद्ध है। तो जो घर की चीज़ है, जो आपके हर घर में आयुर्वेद है, उसकी कोई वैल्यू नहीं है। और जो दूसरी जगहों से एलोपैथी आई है, वो बहुत अच्छी सिस्टम ऑफ मेडिसिन है। बट ऑल दे मीन्स गवर्नमेंट, पब्लिक, सोसाइटी कंसिडर इट एज ए रूटीन नॉलेज, नॉट एज स्पेशलाइज कोडिफाइड साइंस ऑफ द हेल्थ केयर। आयुर्वेद की पहचान की, वो कहते हैं आयुर्वेद तो हर घर में है ही है, हर दिन है। जो भी हम खाना बना रहे हैं आयुर्वेद है, जो भी हम कर रहे हैं आयुर्वेद है वो। लेकिन भाई उसको काउंट कर लीजिए ना हेल्थ केयर सिस्टम में। नहीं, चलिए मत करिए, आगे देखते हैं। अच्छा, तो ये हुआ क्यों हम लोगों के साथ? हमारा आयुर्वेद का गरिमा, आयुर्वेद का अस्तित्व 300 साल में इतना पीछे क्यों हो गया? थोड़ा सा इस पर विचार कर लीजिए। तो from everyone inherited characteristics unit first priority to everyone complementary alternative second priority। आज के 300 वर्ष पहले आयुर्वेद हर घर की प्रथम चिकित्सा पद्धति थी, फर्स्ट प्रियोरिटी। इसके अलावा दूसरा कुछ था भी नहीं, एवरीवन। लेकिन आज हर घर में ये कॉम्प्लीमेंट्री और अल्टरनेटिव सिस्टम ऑफ मेडिसिन है सेकेंड प्रियोरिटी। ऐसा क्यों हुआ, तो देखते हैं। तो मुझे जहाँ तक लगता है, आपकी अपनी राय बताइएगा, कि अनेबल टू कम्पीट विद द अदर सिस्टम ऑफ द मेडिसिन विच आर डिफरेंट इन इट्स डॉक्ट्रिन। ये जो अंग्रेज आए, जो ब्रिटिशर्स आए, अपने साथ एक सिस्टम ऑफ मेडिसिन लाए, दैट इज द एलोपैथी। And the Ayurveda was unable to compete with that system of medicine in its doctrine or the effectiveness on whatsoever things. And that's the reason. And why it happened? Because you see, Ayurveda, Unani, Siddha may work together as per their more or less similar philosophy. एक बात यहाँ पर और डालते चलते कि भाई हमारा कंपटीशन ही नहीं था। यूनानी भी 1000 साल से हमारे साथ थी, सिद्धा हमारे साथ शुरू से ही रहा है, होम्योपैथी भी थी, लेकिन हमारा उनसे कंपटीशन नहीं था, इसलिए हम सब एक साथ सर्वाइव कर रहे थे। बट एलोपैथी से हमारा कंपटीशन हो गया, और एक कंपटीशन पब्लिक ने भी कराया, गवर्नमेंट ने भी कराया, मतलब ब्रिटिश गवर्नमेंट ने कराया, एवरीवन वी गॉट ए कंपटीशन। Back 300 years, Ayurveda was not having any competition, but here Ayurveda is having competition. And allopathy put strong challenges on account of fundamentals, materia medica, application of the core science and the core science and the courses, the evolving biomedical sciences. Of course, the evolving biomedical sciences. ये जो 300 साल में साइंस बढ़ा और बायोमेडिकल साइंस बढ़ा, एलोपैथी उसको अपने आप में एमलगमेट करता गया, और उसने आयुर्वेद के सामने ऐसा कंपटीशन ला दिया कि आयुर्वेद वहाँ एग्जिस्ट नहीं कर पाया इन ए ब्रॉडर वे। बाकी तो आयुर्वेद शाश्वत और सत्य तो है ही है, चलता रहा। तो गवर्नमेंट एंड द पब्लिक सपोर्ट वॉज लॉस्ट, क्वेश्चन मार्क इज देयर, ड्यू टू कंपटीशन विद द एलोपैथी एंड द प्रमोशन ऑफ द एलोपैथी बाय द रूलर्स and the superiority of the Angrezi doctors, the mindset of the Bharatiya log at that time, even today. So इसके लिए जो हमारा मानसिक परिवर्तन हुआ, उसकी जिम्मेदारी किसकी है? अकाउंटेबिलिटी फॉर द डिबैकल। ऐसा क्यों हुआ, हम कहाँ से कहाँ क्यों आ गए, ये था, हम ही लोग जिम्मेदार हैं इसके, द वी इंडियंस। यस, द कन्फ्लिक्टिंग थाट प्रोसेस जो हमारी है कि जो बाहर का है वही अच्छा है, जो कॉम्प्लेक्सेस थे, मैंने इस पर चर्चा कर चुका हूँ। द पॉलिटिकल पैट्रोनेज हमारे पास नहीं थी, ब्यूरोक्रेट्स हमारे फेवर में कभी नहीं रहे। ब्रिटिश कॉलोनियल पीरियड के उस समय तो हमारे राज्य वैद्य हुआ करते थे। 300 साल पहले तो हर राजा के दरबार में हर जगह एक राज्य वैद्य था, हर गाँव में एक वैद्य था। The we Ayurvedist and the system of the medicine Ayurveda, lack of quick response, analgesic, antibiotic, ये सब चीज़ों में हम थोड़ा थोड़ा पिछड़ते गए। आदमी को तुरंत लाभ चाहिए था, वो एलोपैथी दे देती थी। जब एलोपैथी भारत में नहीं थी तो आयुर्वेद से ही चलते थे, चाहे वो 2 दिन में लाभ हो, चाहे रसों सदियों से क्विक लाभ हो। दूसरा अल्टरनेटिव नहीं था किसी के पास। लेकिन जब अल्टरनेटिव सिस्टम आया, जिसको एलोपैथी कहते हैं, उसने चैलेंज किया और अच्छे से चैलेंज किया, तो हमें पीछे हटना पड़ा। और इसमें भूमिका निभाई आम आदमी ने, सरकारी आदमी ने, सत्ता ने, शासन ने, राजनेता ने। देखिए मैंने सब रेड कलर करके लिख रखा है, सबकी अपनी अपनी भूमिका है इसमें। और ये देखिए 31 अक्टूबर का डिसीजन है ऑनरेबल सुप्रीम कोर्ट का, जिसमें इन्होंने अपने रिवीजन को, अपने जजमेंट को रिवाइज करने से मना कर दिया और कहा कि ऑन रिकॉर्ड, मतलब जो भी रिकॉर्ड पर जानकारी है उनको एनालिसिस के आधार पर ये फैसला सही है। तो ये वही वाला फैसला है गुजरात आयुर्वेद मेडिकल एसोसिएशन वाला, जिसमें कि सुप्रीम कोर्ट, ऑनरेबल सुप्रीम कोर्ट ने कहा कि एलोपैथी और आयुर्वेदिक चिकित्सकों को बराबर तनख्वाह नहीं दी जा सकती। और एक एफिडेविट दिया है गुजरात सरकार ने, जिसमें कहा है कि हम नाइट ड्यूटी नहीं करते, हम ओपीडी नहीं करते, हम आईपीडी नहीं करते, हम इमरजेंसी नहीं करते, हम मेला ठेला लगाते हैं। तो वो सरकार के जो एफिडेविट है वो भी गुजरात सरकार की, तो उसके आधार पर फैसला है और एफिडेविट बदला नहीं, इसलिए फैसला सही है ऑन रिकॉर्ड। तो ये सारी चीज़ें हम लोगों को पीछे ले गई, लेकिन उम्मीद की किरण हर जगह रहती है। अब बहुत चेंज है, बहुत बदली हुई है। मेन स्ट्रीमिंग की बात हो रही है कि आयुर्वेद को, आयुष को फिर से लाया जाए मेन स्ट्रीम में। ये तो पहले से ही था, बस आप अब रिकॉग्नाइज कर रहे हैं। देखिए कहाँ से, तो 3 डिकेड्स, पिछले 30 साल की ही बात करते हैं, ज़्यादा पीछे क्या जाएँ। तो इस 30 सालों में हम काफ़ी प्रोग्रेसिव रहे हैं, प्रैग्मेटिक हैं, हम बैक टू बेसिक्स, बिल्कुल जैसा आयुर्वेद एक मान्यता प्राप्त था उस मान्यता को प्राप्त कर रहा है। हम क्लासिक्स के साथ साथ कंटेम्प्रेरी पर भी जा रहे हैं एक साथ। जहाँ साइड इफ़ेक्ट्स झेलते थे अब हमको साइड बेनिफिट्स मिल रही हैं आयुर्वेद की, मतलब एक रोज़ की चिकित्सा के लिए तो वेलनेस एंड रस रसायन की बात आ रही है। और फिर जहाँ एलोपैथी के एडवर्स रिएक्शंस की बात होती थी, अब वहाँ एडवांस रियलिटी आयुर्वेदिक थेरेपी की होने लगी है। तो ये बहुत शानदार चीज़ें चल रही हैं। और देखिए ये पेपर हमने यहाँ पर कोट किया है कि आयुर्वेदा that is the new India vision and the strategy. Ayurveda for new India, Ayush for new India vision and the strategy. This paper is published into the Journal of Integrated Ayurveda and Integrated Medicine, and it's giving the whole scenario and the whole history there. See the contribution of the Department of ISMH up to the 1993, the name was this, and it was Ayush in the 2014, and the global concern of the MSc here. And see, I have given it, that is the education and the practice that is the most responsible. Central Council of Indian Medicine governed this for the 50 years. Now the NCISM is governing from 2020 and onward. Health scheme of the central government, global, WHO, UNDP, UNESCO, UNO, everywhere now Ayurveda is being considered as a good system of medicine, effective system of medicine, and people are looking towards, and that is the reason why everyone wants to again mainstream Ayurveda into the healthcare system. It was specifically in the Indian subcontinent, and it was in another form with the Americans, Europeans in their herbal treatment part. This history of the allopathy is just 300 years back. Americans could not able to revive or survive their own traditional system of medicine because America is the mate of the migratory people only. And all the countries here, I am not deviating from the whole concept, but each and every country has its own system of medicine. But the Indian was much advanced and having the visionary that they documented all this knowledge into the form of Charak Samhita, Susruta Samhita, or the Ashtanga Hridaya, even much earlier in the Vedic culture. That was not available into the other civilizations of the globe, and so we are surviving, and they are just having one thing, that is the allopathic system of medicine. See what Ministry of Ayush is doing in the main streaming of the health, and here the National Ayush Mission and the National Rural Ayush Mission, and really these are the very effective policies and the planning of the Ministry of Ayush. And see this document, mainstreaming Ayush and the revitalizing local health traditional under the NRHM, and this link is available. You can search it and see how the progress is being made. Then come to the contemporary and the current, means what happening nowadays, and see this Niti Ayog document. Yes, Niti Ayog document about the mitigation and the management of the COVID-19, and they have published into the 2022. They recognize that, see the whole scenario, the whole picture, and the link is here, that yes, in the pandemic 19, Ayush system of medicines, specifically Ayurveda, serve in a much better way to the humanity, not only in the India, but at the global level. People are asking and looking for their management of the COVID-19. And see, that disaster was now over. But the humanity will remember all that, all trouble, normal to the elite faced all across globe. And there, this is the recognition of the Ayurveda by the Niti Aayog, this document. See what WHO is saying? Simply, WHO is recognizing Ayurveda like anything, and see WHO benchmark for the practice of Ayurveda. And see, our secretary Vaidya Rajesh Kotecha is saying that from January to February 24 in the ISD 11, the second volume will be of the Ayurveda. First volume was added for the traditional Chinese medicines in the 2011. Now it is being added in a 5-year. Government of India worked for this, the CCRS in the many institutions, and all that. This interviews of the 10-15 days back published into the Hindu. And then Ayurveda will be the global system of medicine in many ways, because the inclusion in the ICD-11 of the WHO is very important and significant for this recognition. Means Ayurveda is going to be the mainstream healthcare system. Abroad, yes, all these things are there, which is the Ayush chair at the Western Sydney University, Australia. And when I was searching, I myself appeared on the Google, my own channel, that is Analytica Ayurveda. When I was searching how it is, what is the status of Ayurveda at the NCCIH. So I have prepared a lot of videos, more than 100, since last 4 months. And people are observing, looking, and considering that some worthy informations are there, and they are suggesting me continuously to do much more on the more elaborative titles that we are doing continuously. So here the Analytica Ayurveda at the rate Professor Anand, if the spelling is little bit different, Analytika, not CA. So the Analytica Ayurveda, if you search, you will get a lot of information there. Then see about our Niti Aayog and in their annual report, and see here the bringing Ayurveda into the mainstream is the ancient system equipped to meet the modern challenges of the health and diseases in the society. Everything is there, but again here we need much here. If you come to the mainstreaming healthcare, the integration versus the holistic, the things are going on. And see, the Banaras Hindu University is the pioneer. Malviyaji Maharaj's concept of the 1904, 1912 and 1916. In the establishment documents of the Banaras Hindu University, he proposed the integration of the two systems of the medicine here very much. And see, the research in the integrated medicine will blend modern medicine with the Ayurveda. The future of the medical frontiers into the integrative healthcare and the medicine. Everything going on in a very right approach. See, the Ministry of Ayush and the Ministry of Health and Family Welfare, both are now combining together. And see this document published by the Ministry of Health, integration of the Ayush with the national program for prevention and the control of the cancer, diabetic, cardiovascular disease and the stroke. See, this is really something which is the integration and the bringing Ayurveda into the mainstream. And see the this document showing the treatment. If you see here, and kindly download it and get it. Here it is the same thing in the different stages of the diabetes. Here in the type 1, it is said the only diet and the exercises, but here type 2, it is the diet, exercise and the allopathic medicines and the Ayurvedic medicines. So that is the concept, that is the mainstreaming of Ayurveda nowadays into the MHC. Other ministries are also working good. See here, Madam Smriti Irani, and see, I remember always full names, so I just cut it. Smriti Zubin Irani, not Smriti Irani. And see the elegant empowering, the heading I have given, that is the Ministry of Women and Child Health Care, including Ayurveda in its own mainstream. This is the Ministry of Defense, that is the Defense Decoration, and all the 37 centers in the cantonment where Ayurveda is there. So the Ayurveda is now being pushed into the mainstream. And what we'll do in the 2047? Certainly, here is a document, must be prepared by the government, and it was the theme of the last year Ayurveda Day of the 2022, Ayurveda in 2047, and many organizations arranged full length discussions on the Ayurveda at the rate 2047 in Ayurveda Kumbh, Ayurveda Parv, and the many more names are there, organized by many several organizations. Why I should name one or two, but this was organized. I'm searching for a document, for a roadmap, what they have submitted to the government and how the government has edited all that, because all those organizations were very much different, and they organized a huge gathering in the discussions. Okay, what will be the Ayurveda in 2047? And finally, the mainstreaming of the Ayurveda, a comprehensive healthcare system. Please, just I am reading it for understanding. Ayurveda was in the mainstream of the healthcare in Indian society from the dawn of the Bharatiya Sabhyata and the Sanskriti. जब से भारतीय सभ्यता संस्कृति है तब से यहाँ आयुर्वेद है, और अभी 300 साल से नहीं है, लेकिन ये फिर हो जाएगी. It will be again in the mainstream of healthcare system up to 2047 on virtue of the powers of the knowledge invested in Ayurveda, फार्मास्यूटिक्स, थेरापेटिक्स एंड डॉक्ट्रिन्स ऑफ द वेलनेस विद द स्पिरिचुअल ओरिएंटेशन. इतनी सारी चीज़ों के बदौलत आयुर्वेद स्थिर रहेगा. फिर से मेन स्ट्रीम में आ रहा है, पूरा दुनिया ला रही है, और 2047 तक तो हम आ ही जाएंगे, क्योंकि तभी तक है आत्मनिर्भर भारत अभियान और आज़ादी का अमृत महोत्सव. और देखिए, अभी 3 से 4 नवंबर को भारत मंडपम में, प्रगति मैदान दिल्ली में, ये ग्लोबल फूड फेस्टिवल हुआ, जिसमें कि फिर आयुष आहार पर स्टॉल है, उस पर ढेर सारे आयुष के ऑर्गेनाइजेशंस ने काम किया, और ये आयुर्वेदा डे 2023 का थीम है. और आई एम थैंकफुल टू ऑल ऑफ यू हु आर हियरिंग मी, एंड particularly the organization who invited me to deliver my views there in the mainstreaming of the healthcare, that is the All India Ayurvedic Specialist PG Association. Thank you everyone, thank you all, and if you need any clarification on these titles or any suggestions, you are most welcome. Namaste, धन्यवाद. Suggestions देते रहिए. Thank you.